Good morning, everyone. Welcome to our next meeting of the Lewis and Clark County Commission. Let's start off with a surprise, right? The Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Okay, I better introduce everybody. To my immediate left is our friend, Commissioner Tom Rolfe.
Morning, Chair Payne.
Good morning. And the fabulous Nadine, whose last name I'm not thinking of, McCarty. But she's been in Hawaii. Yes, we're impressed. Welcome back, Nadine. To my right is Commissioner Andy Hunthausen. And further to the right is Nico Hash and Keegan Shea. Oh, I'm on a roll today, aren't I? And Mr. Roger Balls, our CAO. Welcome, everyone. We have a sign-up sheet at the front of the rail there. And if you are here today, I will hope that you will take the trouble to sign your name and give us your name, rank, and serial number, or whatever else is on the list. And thank you for coming here. Okay, it appears that we have no consent action items. Is that correct? And so, number 3 on our agenda is Sarah Sandau going to tell us what's going on at the Public Health Department.
Thank you. Good morning, Chair Payne and members of the Commission. I am Sarah Sandau, the Community Health Promotion Division Administrator at Lewis and Clark Public Health. Today, I have before you a grant award from the Montana Department of Public Health and Human Services for their opioid education and naloxone distribution program funding opportunity in the amount of $300,000. It would be $100,000 per year for 3 years. The grant period would start on November 5th, 2024 through September 29th, 2027. We have received the state opioid funding for the last 2 years. It was previously referred to as the Overdose to Action from the Montana Public Health Institute. That bucket is now splitting into 2 different buckets, one being more direct service, and that will go to an organization that's undecided at this point, but an organization that works closer with the target population. And then this funding, which is what we're asking for approval, is funding for community engagement and prevention efforts for opioid overdose prevention in a 12-county region, which 12 counties, but that includes Lewis and Clark, Broadwater, Jefferson, Marr, Gallatin, Park, Powell, and then I'll get the others shortly. And the funding covers coordinator time, supplies, marketing, training, and resources. Staff recommends approval, and we are here for questions. And I'll get those other counties to you shortly.
Thank you. Sorry.
Yes.
As I was looking over the contract, I thought, I wonder what counties are all involved. And of course, I asked her, so she is gathering that information. Do we have any questions from the commission?
Chair Payne.
Go.
Sandau. Thank you for being here. Happy to support this, but I just wanted to take the opportunity to tell the public that might be watching today just a little bit about what they might see on the ground, how when we receive these funds and then we're working on the distribution program, how does that look? Where, when, how's it happen? What are the opportunities for people to pick up some of the product and have it available? Where will it be available, I guess?
Thank you. Yes, Commissioner Hunthausen. So the Narcan and fentanyl test strips and other opioid tools and to help prevent overdose will be available all over the goal is to reach people where they are. So yes, we do have it at Lewis and Clark Public Health for the people or family members or friends who attend there, but we realize that's a small portion of our population. The goal will also be to have it in vending machines. We'll have it in people's offices to give it at outreach events that we go to, whether that be different events in our community, whether it's health fairs or just more fun events as well. We will be going to, it will be in the city county building is our goal. We will also have it at all the different health centers. So we'll make sure that St. Peter's and Pierview and Helena Indian Alliance also have access to them, which they do right now. In the 12 county region, we are working with our regional health departments and local partners and nonprofit partners so that they're doing the same, that it is at a variety of local establishments so that wherever you may go, we know that you learn through saturation. So the more you see it, the more you might start to be interested and try to pick one up and have one in your purse as you go.
Thank you so much.
Thank you.
Thanks, Chair Payne.
Commissioner.
Shane, if I might,
Certainly.
just a question, something that occurred to me that, people I've talked to people that are carrying Narcan with them in case they run onto somebody that needs the help. Is there an expiration time on that if you're carrying it that you should be aware of?
That's a really great question, Commissioner Rolfe. There is, I don't know off the top of my head how many years on average that is, but I would love to get back to you on that because that's a great question.
Okay.
It should be on the box though.
Yeah, okay.
Mhm.
All right.
Any further questions? Is there any public comment? Seeing no public comment. No public comment. If you don't give it now, you lose your opportunity. We're done. In that case, let's have a motion.
Chair Payne, I would move to approve the grant award to Lewis and Clark Public Health from the Montana Department of Public Health and Human Services, as explained by Ms. Sandau.
Second.
It's been moved and seconded that we approve the grant award to Lewis and Clark County, or Lewis and Clark Public Health from the Montana Department of Public Health and Human Services as presented by Sarah Sandau. All in favor of the motion, say aye.
Aye.
Any opposed? Same sign. Passed 3-0 to approve this grant award. Thank you.
Thank you.
Okay. Well, nothing further on the formal agenda. At this point, we will ask anyone with public comment on any public matter within the jurisdiction of the commission that is not on the agenda above. Not the real outgoing group this morning. In that case, this meeting is adjourned.